Hello, everyone. Good afternoon. Thank you for having me. I just wanted to share with you a poster that I made the other week. Um, it's something that came together really quickly, but has been quite well received, and I've been encouraged to share it with all of you. Next slide, please. So the idea came to me after talking with one of our nurses in the hematology outpatient clinic. And she told me that the time they quote to their patients for getting blood ready for transfusion is 3 hours. And obviously, normally it doesn't take 3 hours, but I get why they want to set the patient's expectations for a longer wait rather than a shorter one. But obviously, there are times when getting blood ready on the day does take a couple of hours or more, perhaps if they haven't had a sample taken the day before, or if they have an antibody and need an extensive antibody investigation and a manual cross-match. And on these occasions where there is a bit of a wait on the day, the nurse told me that patients can get very frustrated at the length of the wait, and I don't think they understand the quite exactly what goes on behind the scenes. And what was quite shocking to me, I don't know exactly how true this is, but that the nurse said that sometimes the patients accuse them of making them wait for hours on purpose just to be cruel. I think I hope that's just they say that in a joking way, but so that's kind of what inspired me to make this poster, to try and prevent or alleviate any frustration or lack of understanding as to why they might be sitting around for a couple of hours before they can start their transfusion. So I just tried to make a really simple, understandable poster that hopefully we can put up in our clinic, just to show a bit about what we do in a way that's understandable for the patients, under the assumption that they have no understanding of the laboratory or transfusion science, of course. So the first step, checking the sample, checking against the form and the demographics against the computer system, the centrifugation process, which is just a few minutes to separate the blood, the red cells from the plasma. Two main tests we do, a blood group test and an antibody screen, which can take a variable amount of time depending on if they've got an antibody or not. The next step, selecting blood. Maybe the poster implies that we order blood on the day, but normally that's done beforehand. But I just wanted to emphasize the fact that for most of our hematology patients, we do need to get specific suitable units for them. And the next step finally is just cross-matching, whether it be manually or electronically. I think this hopefully demonstrates that we need to test their blood against the donor's blood in some capacity to make sure it's safe. So yeah, by making this poster, I hope that we can just be a bit more transparent about what happens behind the scenes. And I think most of the time patients are really interested. And if they're not, that's okay too. And next time, if they do have a bit of a wait for blood, I hope they understand that it is for a good reason, and will hopefully be happier to just wait a little bit longer. But I do understand that having a transfusion or a few transfusions can take pretty much the entire day. If it's 2 hours per unit of blood, and they might have platelets as well. Yeah, the next thing I need to do is hopefully show it to some patients, see what they think, see if they can understand it, and also I want to get a bit of feedback from you guys, see what you think, if you have any ideas to hopefully make the poster a bit more universal and applicable to your hospitals as well. And it'd be great if you would like to use it. And if you would, then please do just send me an email or give me any suggestions now would be great.